زملائنا الأعزاء، نرحب بكم اليوم في منصة التعليم الإلكتروني المستمر لنقابة أطباء الأسنان في العراق. اليوم سيكون هو المحاضرة مع البروفيسور الدكتور يوسف من دولة الهند، وسيتحدث عن الهاليتوسيس عن دنتس مانجمنت. نرحب بالزملاء من العراق ومن عدد من الدول العربية، ونتمنى لكم يوم علمي مفيد، وإن شاء الله مستمرين بجدول المحاضرات بالفترة القادمة. Dear colleagues, on behalf of Iraqi Dental Association Continuing Education. Sorry, just a second. So, dear colleagues, on behalf of Iraqi Dental Association President, Dr. Abu Bakr Rawi, I'm welcoming you all in the Continuing Education Online program, which is being held by Iraqi Dental Association, supervised by Scientific Committee. Today, we are hosting Professor Dr. Yusuf from India. And Professor Dr. Yusuf, in his second day with us in the platform of CE Online Iraqi Dental Association, he will be speaking about halitosis and its management. Dr. Yusuf will be starting in around 2 to 3 minutes. Again, welcome you all from Iraq, from India, from anywhere else. And we wish you an informative webinar today with Dr. Yusuf. I'm Dr. Abdullah Al-Musawi, coordinator of the Continuing Education Online program of Iraqi Dental Association. So, Dr. Yusuf, I will unmute you now, just a second. Yes, Doctor.
Yes, yes.
Yes.
Can you hear me clearly?
Actually, your voice is far away, far from, I think.
Okay, 1 second.
Take your time, no problem.
Hello?
Yes, doctor, yes. Your voice is clear now.
It's clear. Okay. Should I start or you want me to wait?
Okay, doctor, I think you can start with the highlights of the first part,
Yes.
if it's possible.
Yes,
Okay.
it's possible.
Oh, okay.
A very good evening to everybody. I'm again thankful to Dr. Abdullah and all my dear friends who have joined in today again for the second part. So I'll just, 1 second. The slides are not moving. Just a second. Last time we had started with this new idea of fresh breath clinic. So we had discussed that we should as dentists look at things a little differently. I mean, the moment we look at things a little differently, then we spoke about the bad breath survey, which we had done for around 5,000 people, and In that, we had involved college students, homemakers, celebrities, entrepreneurs, and corporates also. And one second, the slide nahi chali rahi tha. So this was the questionnaire that was put forward, that how many of them ever experienced bad breath? Was it mild, moderate, or severe? And how did they tackle it? And the results were quite shocking, like we had discussed it last time, that many people were suffering from severe bad breath. Then we had few with moderate and a lot with mild also. And the worst part of the survey was, that majority sought help from social media to tackle the bad breath. I mean, that was very much surprising. I mean, since bad breath concerns the oral cavity, it should actually be done by the dentist. So then and the bad breath industry is massive, massive. I mean, it's touching 23.21 billion US dollars. I mean, so much of revenue is being made by companies who are selling bad breath products. So there is a demand. There is, I mean, in a short survey, we could make out that almost 90% people are suffering, and very few are going to the dentist. The prime reason was that majority of dentists would only do an oral prophylaxis, or they would do some gum surgery related activities and prescribe a mouthwash and toothpaste. That's about it. And they would not be satisfied, and then they would change the dentist, and the second dentist would also give them very similar option. So then they started resorting to Facebook, internet, social media, various forms, and companies, whatever they could offer, they were picking up, just based on the social media. And we also concluded that each and every one of us suffers from bad breath. Each and every one of us suffers from bad breath, and only the levels might vary. Then we just spoke in brief about the volatile sulfur compounds, that is basically hydrogen sulfide, methyl mercaptan, and several other similar compounds. And then we spoke in detail how the bad breath actually happens. And we spoke that the bacteria which are there, the anaerobic bacteria, they generally harbor on the tongue surface, throat, tonsils, gingival crevices, and periodontal diseases, and they combine with food, mucus, saliva, phlegm, blood, and all that is available in the mouth, and they produce proteins which are further broken down into volatile sulfur compounds which produce the oral malodor. This was the basic mechanism that was explained. And then we spoke about the different types of bad breath, that is the pathologic, transitory, physiological, and halitophobia. Pathologic was related with dental and medical pathologies. Dental problems, everybody knows that if you have a decayed tooth, if you have gingival bleeding, periodontal disease, an abscess, ulcer, and oral cancer, definitely the mouth is going to be in bad situations. And then we discussed the various medical conditions, for example, diabetes, blood pressure, cardiac problems, and a series of other disorders which were connected with bad breath. So either it was the disorder which caused the bad breath, or it was the medications or the medicines that were taken to tackle the disorders that was causing the bad breath. Then we discussed about transitory bad breath. This generally happens due to the food intake that we do. It is because of the various food products which we took. And then we spoke about the physiologic bad breath, that is because of the presence of the tongue. I mean, the tongue is a grassy lawn on which a variety of things get stuck. A variety of things get stuck very easily. And there is an interaction with the anaerobic bacteria, and there is production of volatile sulfur compounds. So tongue played a very important role as far as the bad breath is concerned. Because see, many a times, what will happen? You will get a patient who doesn't even need oral prophylaxis. He doesn't need scaling and polishing. Then what do you do? So that's the time a detailed examination will show us that there is something on the tongue also. The tongue cleaning is a major thing. And then we spoke about halitophobia. And then since everybody has a tongue and it occupies a major portion in the oral cavity, so we very vehemently concluded that bad breath is a problem which each one of us face, only the intensity varies. Then various methods of testing the bad breath. You can test whether you have bad breath just now directly. You just take your hand, just lick it and smell it after 30 seconds. That's the intensity of bad breath you have. Have a look at your tongue in the mirror. If there is a coating on it, be assured that you have got bad breath. But many a times we stay in the same household, we are in the same surrounding. So the same odor is there. So we sometimes don't feel that there is anything wrong. Unless an outsider comes in. When an outsider comes in, he feels that there is something different in this air. And then, of course, the method which has been suggested here by Shah Rukh Khan, you can ask your spouse or your close friends to tell you very honestly. I mean, because you have to be in close proximity to really smell each other. And then there are scientific devices also available, like the halimeter, which actually tells us the level of volatile sulfur compound. And this is a very important tool, a very, very important tool. And then you have the pocket halimeter also. So this can also be given to the patient themselves. The patient can carry the stuff along with them, and whenever they feel, and then they can manage it accordingly. Then we started with the management of bad breath. The basic treatment in the first appointment. See, there's a lot of discussion that is going to be happening. There's a lot of history taking which happens because, like there might be many reasons attached with the bad breath. So you have to get to the core of the issue. You have to get to the core of the matter. So a detailed intraoral and extraoral examination is required to find out any dental possibilities. Then the second is the medical history. See, because if the dental aspect is there, we as dentists can tackle it very easily. But if there is any other medical history, we need to have a look into it. Okay, because what are the medications is he taking? Is he an hypertensive? Is he a blood pressure? Is he a diabetic? Or does he have any cardiac problems? So the medicines which they are taking is also causing dryness of mouth. We have to understand that dryness of mouth is one of the major causes of bad breath. So that has to be taken into account, and the solution has to be offered, accordingly. And then bad breath testing also needs to be done because that is like a test. You have to do it at various stages. Okay, and then diet counseling plays a very, very important role because diet is very, very critical as far as the bad breath is concerned. And finally, the oral hygiene instructions. You as a dentist, you have to tell them which toothpaste, toothbrush, mouthwash, everything related, anything that goes in his mouth. To it has to be prescribed by the dentist. Then we spoke about when we go for weddings and all that. Look at the amount of food that is being served. An amazing variety, sugar loaded and protein rich, especially in the non-veg section. And then there are sweets. We have these things also, and we have a habit. Okay, a date is very good, but we modify it. We add a almond in it. We have chocolate dates, so that spoils the whole thing. And then generally there is always a starter, there is a soup, there is a main course, and then of course the dessert. So it is the last thing. Understand very clearly. It is the last thing that you have in your meal is what is going to remain the maximum in your mouth. So that is going to cause the bad breath or the halitosis. Okay, that is the one which is going to cause the halitosis. Is going to play a major role. So what you have last is very, very critical. And then of course cold drinks. Cold drinks in no way are good for health, but they are very, very popular. Energy drinks. So all we have to do is break the sequence. Your meal should never end with a dessert or a cold drink. Okay. Then there are certain fruits. So many people opt for fruit salads. Fruit salads are very good, but remember, for halitosis, a custard apple or a mango or a chiku should not be the last thing that you have consumed. Because if it's the last thing that you have consumed, it will stay back on your tongue and you'll be having halitosis. So you should have a lot of fibrous fruits at the end of your meal. Towards the end of your meal, have a lot of fruits, especially the apple, the berries, the citrus fruits. What happens because they are fibrous in nature? Okay, they are water based. They will not stay in the mouth, and because of the fibrous nature, there'll be increased salivation. And because of increased salivation, There'll be washing away of a lot of food debris that will be there in your mouth, and that will definitely reduce the intensity of bad breath. There are a lot of other foods which are there, for example, ginger, cinnamon, mints, vegetables, cardamom seeds, guava leaves, all this help in bad breath management. And then we spoke about the cucumber. Then we spoke about the dangerous things that are available. This is how a real life pharmacy should look. This is what I call as a medical store. Every fruit has its properties. A banana is loaded with calcium. Okay, citrus fruits, vitamin C. And unfortunately, civilized society sells poison and uncivilized people sell real food. So these were the home remedies. Then we had stopped over here. So today the discussion begins 10 foods to fight bad breath. I mean, you don't have to always take a mouthwash, toothpaste, toothbrush, and all that. Basic begins with the diet. That's why the diet counseling is very, very important. Green tea is definitely a very, very good thing to try out because it's got a lot of antioxidants and it's that fight the growth of the bacteria and they reduce the levels of sulfur compounds which are responsible for bad breath. So green tea and research has shown, okay, that green tea is definitely good for your health and definitely for your bad breath management. Then apples because of the fibrous nature. Okay, the fibrous nature of the apple, washing away and cleansing mechanism is there. Then green leafy vegetables again because of the fibrous nature. Okay, but the moment the green leafy vegetables is converted into a salad in which you add mayonnaise and all that stuff, cheese and cream and all that, the properties get vanished. Any healthy food, I mean, by adding all this stuff, the properties change. Then probiotic yogurt, very good because, and it is technically a bad breath neutralizer and it has got tremendous health benefits. So having this definitely banishes the odor. Then water, I mean, no better thing than water. I mean, you need to be hydrated continuously. Have a lot of water. Now, one thing you have to remember that, like how much water? Okay, research has shown you have to drink between 5 to 7 liters depending on your age and related factors. But remember one thing, when water, suppose you're working in an office kind of an environment, and you say that for an office there is definitely going to be an AC. In an AC environment, definitely there is more probability of you having a dry mouth. And especially if you're in a call center job or you are in a job where you have to speak a lot. So in such a situation, you'll have a lot of dryness of mouth, which will cause bad breath. So in such a situation, you are not supposed to drink glasses and glasses of water because if you have a lot of water, then you'll have to go to urinate. So you can't be running to the bathroom every 1 hour. So the solution for that is that whenever your mouth runs dry, have little sips of water. Sipping of water is recommended. Then parsley and basil, very good. Okay, because they are kind of a, like you can say a perfume for the mouth. Then strawberries again, they're again rich in vitamin C. Okay, they are because of their water content again, they tackles the dryness of mouth. And vitamin C has creates an hostile environment for the bacteria. And of course, the healing process, if there's a lot of ulcers and all these things, which again cause bad breath, strawberries can play a very important role. So you should know the fruits which you should carry in your meal box. So you can have that towards the end of the meal. Because if you're having a non-vegetarian diet or a diet which is, like for example, even a sandwich, which has mayonnaise, cheese, and all that, they are milk products. They stay back on your tongue. So if they stay back on your tongue, definitely you have a very high probability of bad breath. So in such situations, your meal should always end with a fibrous fruit or a vegetable. Okay, that should be the key factor. I mean, having a 2 slices of apple will take care of all the other things that you have eaten before. Then ginger. Ginger is a very old remedy for upset stomach. And though stomach related problems and halitosis is not very closely connected, but it does help a lot. And what is happening that if you take ginger and mix it with lemon juice and warm water, I mean, it becomes a natural home rinse and it definitely takes care of your malodor. Then honey and cinnamon combinations have been discussed at large. They say it has got very good, it works very well against halitosis. Okay. But I always feel that honey should always, I mean, if you're taking this combination, I mean, I would not advise you to take cinnamon powder and take a teaspoon of honey and have it. I mean, that would not be a very, very conducive thing. I mean, you can always take a little glass, a small glass of warm water, place your honey in it, and add your cinnamon powder and have it. That would be more effective. And some researchers have said that it does, like say, and in one of the studies, they clearly stated that Manuka honey, just one second. You switch off the volume over there, boss. With my mic off, Rakelo, don't play around with those. Just switch it off. You don't need it. We can listen to it. Mic off, Rakelo. So Manuka honey is considered very rich, and it is a dark liquid which is produced in New Zealand by bees that pollinate on Manuka bushes. They have found that Manuka honey is definitely very good for treatment of bad breath. But I personally, I mean, having this directly on a spoon, because ultimately it's a food product. So its liquefied form in added in warm water is always advisable. Then chewing of fennel and cardamom seeds, they found that they increase the salivary and plaque pH. And what happens is that because of their fibrous nature, there is increased salivation. So they definitely take care of bad breath. Then green tea, as I mentioned in the beginning, are we having it right is very critical. It's not that green tea you keep on having 2 to 3 cups. Maybe, the quantity should be very less. Okay, and they should never be had on an empty stomach. Okay, and definitely not immediately after meals. You have to avoid having green tea after meals. It is generally best to have green tea 30 to 45 minutes either before or after your meal, not immediately. Night sipping definitely is not permitted because it will change your sleep patterns and increase stress levels. And please don't reuse the green tea bags, because many people have the habit. They have that one bag and they'll keep on dipping it and using it, dipping it, using it. No, no, no. That is not recommended because the caffeine content in an already used tea bag is frightfully high. We have to take care of that. And have, again, more plain water. Okay, whenever, because green tea is also a diuretic that may lead to frequent urination. So just drink more water to hydrate your body. Research also has shown that they have studied effect of green tea on volatile sulfur compounds, and they found it's very effective in reducing. So a small, even the very tiny glasses, maybe 20, 50, or, in quantities of 100, 200 ml, you can have it 3, 4 times maybe. But, having a full cup of 200 ml is not advisable. Then kava is, again, I mean, it is your drink. I mean, it is, who makes kava better than the Arabs? I mean, it definitely has its benefit. But here again, we have to avoid adding sugar in. I mean, I don't know whether you really add, but here at many times I've seen people to make it a little more tastier, because all the ingredients of kava are, I mean, very effective in controlling bad breath. They put generally Arabic coffee powder, and they add cardamom, which we discussed, saffron, ginger, and clove powder. All these products are very good for, I mean, clove, everybody knows that is very good for the teeth. We have clove oil in so many of the toothpaste formulations. So this is definitely very good idea. I mean, you can have kava as many times. I mean, generally recommended 3, 4 times only, but never misuse it too much. And then coffee. Coffee also has a very good effect on bad breath. But here again, the black coffee is recommended because see, the moment you add milk and sugar to it, the inherent properties are lost. Okay, adding milk and sugar kills the basic property, but having a nice black coffee, I mean, you need not make it very strong. Okay, a light cup of black coffee definitely will take care of the levels of the volatile sulfur compounds and reduce malodor considerably. Then miswak, traditional things, traditional things which were there are always very effective. I mean, Look at the components of a miswak stick. It contains silica, which is the abrasive. Okay. And then you have tannic acid, resins, alkaloids, essential oils, sulfur, vitamin C, sodium bicarbonate, calcium, fluoride. The products are all good, all have beneficial effects on the oral cavity. So definitely using of miswak is recommended, but you know, it can be, it cannot, see, we are used to the electronic toothbrush, we are used to the normal toothbrush. So brushing with miswak will not help us. So in such situation, what I will recommend, 5 minutes in the morning, you can just take the miswak stick and just chew it around. So all the juice that comes out has such lovely product list, such lovely content, which will definitely help you take care of your bad breath. These are the properties which we discussed.
ओ खई के पान बनारस वाला ओ खई के पान बनारस वाला खुल जाए बंद अकल का ताला ओ खई के पान बनारस वाला खुल जाए बंद अकल का ताला फिर तो ऐसा करे धमाल सीधी कर दे सबकी चाल ओ छोरा गंगा किनारे वाला ओ छोरा गंगा किनारे वाला.
Any guesses, Abdullah? Who's this personality?
Sorry, doctor, I could not hear you. Sorry.
Do you know who this gentleman is there who is dancing?
No, actually, no.
Yes, he is Amitabh Bachchan. Okay.
Amitabh, he's also popular, like the Amir Khan we spoke about.
Yes. But this is the younger Amitabh. This is in the 1980s. So here he's
By the
talking
way,
about a very lovely. Yes.
he doesn't look in the same way that he looks now. I know him now.
Yeah, now he's 75, 78. That time he was 40. That's a little difference.
Yes.
So what he's recommending, he's recommending this particular product, which is called as the pan. Okay. So he's singing and telling us that he's talking about the beneficial effects of the pan. So pan again is a very old traditional, and it is a very famous Indian mouth freshener. Okay, because see, bad breath has been a problem from the time of inception of mankind. It is not a new problem. Okay, and everybody was concerned how their mouth smelt. Okay, so this is a very old tradition. So this is the pan, and it can be considered as a cure for bad breath also, because that should be the last thing that you should eat. Generally, in an Indian meal, wherever you are going for a function, the last thing that is offered is a pan. So now, what is a pan? Okay, pan is basically betel leaves, and they've got very good antibacterial properties. Okay, so they decrease the bacterial count, and then in that pan you add something called as gulkand. Gulkand are rose petals which are dipped in a sugary solution. Now that is the catch. The gulkand is got very soothing effect, but sometimes people like add a lot of quantity to it. So sugar again is food for the bacteria. So this is one content which you can keep aside, maybe in the from the pan. But people add it because it gives that benefit of cooling taste of rose petal. And then you add coconut powder. Okay, coconut powder is added, and then you add soft or fennel seeds to it, and then you add a clove. Okay, so this is the basic component. Of course, here this is the basic components of a good pan. And if you have this, again, pan being a vegetable format, it will increase the salivation, and all the contents which are there definitely help to take care of halitosis. But what people have done, they've added tobacco to it, calcium hydroxide powder, areca nut, and they have made it cancerous. And people have modified pan. Okay, in India, the pan which I showed you was the original pan, but they have made it chocolate pan, they have made frozen pans, they have put strawberry pans, they have put dry fruit pans, and such many varieties. So what has happened? They have added a lot of components which make it tastier, but the health benefit is taken away. A chocolate pan, how does it help? I mean, it's like, having a medication. I mean, like, a sugary, you are giving a xylitol chewing gum, for example, but you have dipped it in kind of sugar-based solution. So there is, for example, I'm sharing the wrong example actually. It's, for example, tea. Tea has got a lot of fluoride in it. It's got anti-carcinogenic properties. So black tea is very good for the teeth. But what we have done, we have added milk, then we add sugar, and we spoil it. So that's how the pan has been spoiled. And plus, they add a lot of areca nut to it. So areca nut again is one of the agents which causes oral submucous oral cancer, and addiction. See, this is how generally a pan is served. But I would stress on the basic pan. So you have to make arrangements for betel leaves, okay, and then you have to remove the stem and fill it with these ingredients which we mentioned. That is the fennel leaves, that is the soft, the gulkan, you have to put the coconut powder, and you have to add the clove. So that's the pan which will take care of the bad breath. But the other components that you add to it, the chocolate, the sweet, and all that stuff, that spoils the whole thing. Then cold drinks. Everybody enjoys cold drinks. Cold drinks is a favorite. In every clinic, I say, you should have 4 5 bottles of Pepsi or maybe Thumbs Up or any aerated drink. If there is a fire, it is an immediate solution. I mean, and in many parts of India, they are used as pesticides also, cheaper pesticides. And then we should see, before we have a Coke or a Pepsi, have a look at the contents in detail. I mean, a regular thing contains water, sweeteners, sugar acids, preservatives, and a diet one contains acid. Acids are there. Okay, so you are providing acids. And look at the amount of sugar which is present in the cold drinks. The figures might be more or less. We have picked it up from the internet. But cold drinks do contain a lot of sugar. And these were the other things, all the drinks that were available, Coca-Cola, Diet Cola, the various milkshake, their pH. Most of these drinks have a very acidic pH, which again serves a good base for the bacteria to multiply. And then we jotted down the 7 side effects of soda. Weakens the bones, rots the teeth. Excessive artificial sweeteners make you crave for more. See, when you have Pepsi, you want to drink more, more, more. It's same thing like the chips which we have. Once you start with the potato chips, you want to eat it continuously. There is a craving. And then caramel color is made by, it's purely cosmetic. And coloring agents, carcinogenic. Then formaldehyde. See, the carcinogens, it is not, I mean, what happens? Aspartame is added to many of the cold drinks, and they break up into 2 amino acids and methanol, basically formic acid and formaldehyde. Then high fructose corn syrup is used. Then potassium benzoate, food dyes. In no ways cold drinks helping us a lot, but they are providing the bacteria a further chance. They cause a lot of dental issues, and this is what is caused. Frequent drinking. I mean, when you go for movies, they give you a jar, half a liter is consumed. Then we have our favorite drink, tea. Tea is lovely. Yes, it's refreshing. But tea, again, it is support. What does it do? It causes a lot of staining. The more the stain, the more the retention of plaque, and definitely more the probability of you stinking, bad breath. And tea was supposed to be had, as I say again, black tea. Black tea is always preferred. And without sugar. See, the moment you add milk and sugar to the tea, the beneficial effects of tea are lost. And that's why a lot of recommendations for green tea. Then we come to brushing. Everybody knows brushing 2 times a day, 3 times a day is recommended. Yes, very good. But we have to actually teach the patient properly. But we don't have any problem with the brushing. We have to be very careful when we have the toothpaste. Because see, and this I'm not talking from a general dental point of view. From bad breath point of view, you have to be very careful about the following toothpaste. Now see, if you all have seen various toothpastes, at the end of it, just a sec. every toothpaste, I don't know whether it's clear, this part, they will be color coded. If it is black, that it is purely chemical. If it's red, it's natural and chemical. Blue is natural and medicine. Green is natural. So you should know, you should go through which color code is there. And then understand toothpaste with alcohol. Alcohol causes dryness of mouth and it increases halitosis. Plus you have sodium lauryl sulfate. So you have to be careful when you prescribe the toothpaste for bad breath. You should see that they do not contain alcohol. These are some of the toothpaste which you just picked up randomly from the Indian stores. Then I was surprised some toothpaste contain nicotine also. I mean, what is the role of nicotine? I still fail to understand. I mean, so many Indian toothpaste, I checked it and they contain nicotine. I still don't understand any beneficial effects of nicotine at all. Then tooth powders containing nicotine. Then there are some toothpaste which contain alcohol and tobacco. Wow, tobacco in the form of nicotine. Definitely you don't want them to be given for halitosis management. Then there are some toothpaste without alcohol. They are good, but they contain sodium lauryl sulfate. What will you do? Again, it's a drying agent. Then of course, toothpaste with fluorides are there. These are definitely recommended. So we just made a list of alcohol containing and alcohol free toothpaste. So this takes care of first part of our halitosis, that we will not prescribe an alcohol containing toothpaste to the patient. We'll recommend an alcohol free toothpaste. But there is a second problem, that if you recommend an alcohol free toothpaste, but it still contains sodium lauryl sulfate. So then I bumped into these toothpaste, but this is a mistake. Phenolene contains alcohol and nicotine both. Okay. So the toothpaste which we use for sensitivity, they do not, majority of them do not contain sodium lauryl sulfate, which is a foaming agent which causes dryness of mouth. And of course, it causes halitosis. So if you have to prescribe a toothpaste for a patient with bad breath, these are the toothpaste that you can recommend. Please check out for toothpaste which do not contain alcohol, nicotine, and sodium lauryl sulfate. That's the toothpaste for your halitosis management. It's simple as that. The brands might vary, but you have to check for that. Okay? Because see, if he uses the normal toothpaste, because see, generally a person who's suffering from bad breath will brush 2, 3, 4 times in a day. And every time he is going to cause dryness of mouth, and it is going to exaggerate his bad breath. So that doesn't help. And various companies have come up. I mean, you just have to Google and you will come across a lot of stuff. All that you have to do is check their content and then recommend it accordingly. Now a small video.
Hi, I have a question and I want to do something about this. Why does toothpaste come in a box? This product is used by 2/3 of the world's population on a daily basis. The box makes it more expensive for the makers and for the buyers. And the only thing we do with it is to throw it away. Then why? What's the point?
Because it looks better.
That's right. And every year, 900 million useless boxes are produced only in the United States. So the question is, who can change this? Politicians? Corporations? Well, there's one place where this is done differently. And that place is
Iceland!
Iceland. Iceland is the second most environmentally friendly country in the world. And in this small island, 90% of toothpaste tubes come without a box. But it wasn't always like that. Icelandic people made a drastic change in the way they consume and treat waste.
Because of the animals.
Because of global warming.
So that we're safe.
So we won't die. So we have a planet to live on.
Because we only have one.
And this new consumer behavior forced politicians and corporations to make changes, including toothpaste with no boxes. Which means that the answer to who can change this is you and me. So, step 1, buy only toothpaste that comes without the box. I know it's hard, but if we all do it, it will change. So stick to it. Step 2, tag on this video anybody you know that works in the government or in the toothpaste industry. Step 3, spread the word. Share this information so that in 1 year from now, we can see this everywhere around the world. Sometimes it feels like we live in a society that it's out of our control. But the truth is that big changes start with ideas. Here's an idea. Let's get rid of this. Are you in?
An amazing video, which I always show it to everybody. And we from our side are also trying. It will take some time because it's packing, logistics and all that, but we can always keep on trying.
We clean our teeth every day. But did you ever consider the environmental impact caused by your toothbrush? The plastic toothbrush is not biodegradable, and neither is the plastic packaging. Plastic comes from oil. That's a fossil fuel. There is nothing in nature that biodegrades plastic. Even recycling is not a solution because our recycling facilities cannot keep up with new plastic production. The truth is that only 8% of what goes into the recycling bin is actually recycled. All of the plastic toothbrushes you've ever used in this lifetime still exist. In fact, all of the plastic toothbrushes created since the invention of the plastic toothbrush in the 1930s still exist. Billions of plastic toothbrushes end up in our landfills and our waterways every year. Quit plastic. Brush with bamboo.
So this is a new alternative that has come that we should start thinking about it. I mean, nothing wrong. Slowly and steadily, the change will come. Then bad breath and tongue. Now, most of us clean our tongues, but how many of you all clean your tongue with a tongue cleaner? I have observed majority of people clean their tongues with the brush. Now, when you clean your tongue with the brush, what you do is you just remove the plaque from the tongue surface and it goes everywhere else. So please have a look at some good quality tongue cleaner. It is you who have to recommend, because tongue occupies a major surface in the oral cavity and maximum food retention happens on the surface of the tongue. And many tongue cleaners are definitely available, but the problem that we notice with tongue cleaners is that you tend to have a gag. So after a lot of work around, I developed this particular kind of a tongue clean. Okay, it has got a handle proper, so you know at what extent, because see, we came across a variety of tongues, something like this, and the steel ones are very famous. Okay, and then we have something like this also. And then this looked very dangerous. It looked like a razor. But that is also there. And then you have something like this. I technically picked up all the possible tongue cleaners that were available, and then I developed this particular kind of a tongue cleaner. Okay, it's like got a stop, so you can hold it to a particular level, and then it's got a surface, and then it's got a collecting part, and then you clean your tongue. I found this really good. And the beauty is the scheduling of tongue cleaning is very important. You, in the morning when you get up, you brush your teeth, okay? Then you have your breakfast and then you clean your tongue. Before leaving your house, you have to rinse and clean your tongue. And tongue cleaning is recommended after every meal, okay? Brushing may not be that critical. Rinsing might take care of a lot of things, but a lot of food stays back on your tongue, okay? And in the morning, generally we have eggs, cheese, toast, and all that, tea, coffee. All this is going to stay back. So cleaning of your tongue is essential. This is the tongue cleaner. I mean, you can pick up the one of your choice, whichever is available. But tongue cleaner is a big part. And of course, flossing, I don't have to teach. Most of y'all are dentists over here, so flossing is important. And you need to teach them, and rinsing after every meal, and mouth washes. Mouth washes play a very, very critical role. And majority, as per our survey, people picked up mouth washes based on the advertisements that were coming. I mean, they didn't pick it up. And the beauty is that nobody knows how to use a mouthwash for how long. That is has to be taught to them. Variety of mouthwashes are available, but for bad breath management, you should know alcohol. Many of the mouth contain, I mean, we just made a list. There are some mouthwashes which contain a lot of alcohol. So if the mouthwash contains alcohol, again, alcohol is a drying agent. It causes dryness of mouth and it will increase your bad breath. So it's just like a perfume. What's the point? So look out, especially for your patients with halitosis. You have to pick up a alcohol-free mouth. We bumped into, and a lot of products are available. And I love the Indian traditional products. I landed up with this beautiful herbal mouthwash, which contains clove, triphala, and all these extracts, which have a major role in bad breath management. And they work real wonders. And they are very safe too. So rinsing of mouth with the mouthwash helps a lot. And it should be just done twice or thrice in a day. And cleaning of the tongue is very critical post meals. Then various types of mouthwashes are available. The basic that you have to keep in mind that when you are recommending it for bad breath management, the first thing that you have to see that it doesn't contain alcohol. Okay, that is the first point. And then we have to move towards the herbal, because chlorhexidine mouthwashes you can't give over a long period of time because it causes staining of the teeth and you have to stop. So you have to pick up those mouthwashes, and especially these herbal ones. They do not stain so easily. Okay, so you have to check the ingredients of the mouthwash before recommending it. And we did not go into the details, but these are the mouthwashes which are there. We have the cetylpyridinium chloride, both chlorhexidine and essential oils. How often you take it has to be controlled. Otherwise, staining is there. And of course, fluoride mouthwashes definitely help, and peroxide mouthwashes are used in especially for whitening. And mouthwashes, not only do they help in the odor management, but they take care of the other thing also. Like alveolar dry socket is there. There'll be severe bad breath. In cases of severe plaque and gingivitis, tooth decay, they definitely help. These are some of the mouthwashes which we bumped into, and they are really nice. They're really nice, and you can definitely try them out. Okay. And for children, is the other mouth, because even children suffer from halitosis. Okay, there are children, but how safe it is. Generally, we recommend mouthwashes beyond 7 years of age. Because what happens, otherwise they keep on drinking it up. They should be able to expectorate, they should be able to spit it out. So what we recommend is that choose an alcohol-free mouthwash. Hold on to the mouthwash yourself. I mean, keep it under your supervision. 6 to 7 years, and maybe till the age of 12, we can say that mouth washings should be used under parental supervision only. And it has to be kept somewhere high, far away from the reach of children. Bad breath is again very common in kids because they have a lot of sugary things. Even the syrups, the medication, the basic crocin syrup, okay, it is fully loaded with sugar. So all the syrups which are there are loaded with sugar. So that you have to be very careful. And plus they have a lot of milk products, cheese, milk, and all that is very often. So that also has to be taken care of. And halitosis in children was again found because of poor oral hygiene, dehydration, eating smelly foods, medical conditions also. And of course the medications, because most of the medication, pineapple flavor, strawberry flavor, orange flavor, they will definitely cause halitosis. And the procedure in which you give it, they are dumped in the mouth. The child doesn't take it, and generally what we tell that after you have given your medication, give them a little bit of water. At least those don't stay around. And of course, dryness of mouth is the major cause of bad breath, and drinking more water is the simplest of solution, but not in like glasses, sips of waters is recommended. And miswak, we already discussed in detail. Miswak, I don't say you replace your electronic brush or your normal brush with miswak. Okay, don't replace it. Use it as an adjunct. At least once in a day, just chew onto it for 5-10 minutes. What's the problem? If you can't do it every day, tell the patients on weekends use it, please. Because the ancient things are really good. They are tried and tested. Okay. Then I bumped into something called as a chew brush. Now, see what happens. It's very easy to tell the patient that you brush regularly, you brush 3 times, you do this after your meals and this, that. Now, suppose you have gone for a wedding or a party. Okay, and I have told you that you have to clean your tongue because after every meals, cleaning of tongue is very much essential. But now, how will you clean your tongue in front of so many people? Okay, so this is a special handle-free brush. You have to just pop it in your mouth and chew it for 2-3 minutes. When you chew it for 2-3 minutes, what happens? It increases your salivation. And increase in your salivation, okay, what happens? Reduces the marrow. So this you can use it on the go. Of course, ideally it is to be used, it is a disposable thing. Okay. But sometimes the cost might be an hindrance. So what I always tell the patient that after you have chewed onto it, wash it nicely, put it in the pack properly, and then reuse it. Because the idea is, because of this brush, we are not expecting major amount of, cleansing mechanism. The whole idea of using this brush is to increase your salivation. Okay. And of course, it contains xylitol also. Okay. So it definitely helps. Just chew it for 2-3 minutes and the flavor in your mouth will definitely change. Then chewing gums. Chewing gums are heavily recommended. Sugar containing ones, what will you do? If you chew a sugar containing, it will spread the sugar all around. There'll be increase in the bacterial count and halitosis. So you have to use sugar-free mints. Happy Dent is there, Orbit is there. All these are available. But understand that chewing gums are supposed to be chewed only for 2 minutes. Okay. Most of us chew it like cows. Continuously, it's going on and on and on and on. See, the more you chew, what is happening? That is causing dryness of mouth. And dryness of mouth is the main cause of bad breath. So you feel that freshness initially, and then after some time, your mouth starts stinking. So any chewing gum that you recommend, only for 2 minutes, not beyond that.
विको टर्मरिक नहीं कॉस्मेटिक, विको टर्मरिक आयुर्वेदिक क्रीम कील मुहासों को जड़ से मिटाए, हल्दी चंदन के गुण इसमें समाये, त्वचा की रक्षा करे आयुर्वेदिक क्रीम, विको टर्मरिक आयुर्वेदिक क्रीम.
Now, turmeric has a very major role, and in India we are turmeric fans. I mean, if we have a cough and cold, or if we have a sore throat, the first thing that will come to our mind is nice warm milk in which we'll add clove and turmeric. Turmeric properties are amazing. It can be used as a skin cream. It can be used in forms of, it's a natural teeth whitener also. It can be used, it is edible. It's available in edible and non-edible forms also. Okay, so how does turmeric help in bad breath? The major component of turmeric is curcumin. Now, this curcumin which is there in the turmeric, it's an antibacterial agent. And it also prevents the development or colonization of the bacteria. It inhibits plaque formation and it treats inflammation of the gums. Okay, so all these things definitely help. So my friend helped me make this curcumin. These are special mints which contain turmeric, that is curcumin. Okay, and they are sugar-free also. So you pop in one, you are having the medicine also, and plus it's taking care of your bad breath. Such is the property of this curcumin. So when you recommend a mint, I mean, I always say, don't just have any sugar-free. You should know what to recommend. If this is what you are supposed to take and when you are supposed to take. So this I recommend generally after every meal. Or whenever I tell, if you are in an office, keep this pack in your pocket. Whenever you feel your mouth is sticking, just pop one in. It doesn't contain sugar and it is a medicine. And you can have 3, 4, 5 to a maximum 6 to 8 per day. There's no problem. Rather than having a Polo or any all those sugar containing milks, which what they do is that they just improve the fragrance in the mouth, but they don't help otherwise. And then you should have a proper fresh breath kit for the patient. See, after you have done your consultation with your patient, you have taken care of his dental problems, you have assessed his medical conditions, you have tested his bad breath, and after that, the home remedy is very important. Okay, so you have to give him a specific kit. You just can't tell them use any good quality mouthwash, use any mint or any chewing gum. No, you have to be specific that you're going to use this mouthwash because I know the contents. You're going to use this brush. See, this is my fresh breath kit. This is how my price. It contains a mouthwash, it contains a handle-free brush, and then we have a tongue cleaner and we have a mint. Okay, and these they can use in the initial phase. They'll have to use it regularly, but our aim will be towards the end. It is just the handle-free brush and the tongue cleaner which will take care, and mints in case of an emergency. I mean, they don't have to be dependent on something for life. It is to be used initially to help them out, and then they have to use it in a tapered fashion. So this is what is recommended. This is how I give them the kits. So what happens is that they know what to use. I mean, we as dentists know toothpaste, mouthwashes, brushes in detail. So why should the media, why should the companies talk about it? It is we who have to recommend. We have to assess. And luckily in dental products, what happens? You read through the ingredients, use it yourself, and then you can give. We are lucky, see, in the dental profession, majority of the products we can try it ourselves, evaluate and assess ourselves, and then recommend. Why should the patient go through the media and advertisement? We are the specialist of the mouth, so anything that goes in the mouth has to be done through us. Hope you, this is the concluding part of my presentation. I hope all of you all like this idea, because it's really innovative and it is something which everybody has facing it. So you have to provide the solution. And innovation can happen in any format. So it's just the beginning. And I'm again thankful to the Iraqi Dental Association for giving me this opportunity. To speak. And a very special thank to Dr. Abdullah, because he was the one who helped me out in all this. And I'm so thankful to you, Dr. Abdullah, for all the help that you have given to me. And believe me, all that I could do is because of, I teach in Chunawala Dental College in Pune, and this is my team. Okay, this is my team of staff and my postgraduates. Some are missing in this. We totally have 18 postgraduates. We have 6 postgraduates joining us every year. So a few of them were absent, so they were not part of the photograph, but we have 18 postgraduates there. And it has all been a team work. I mean, whatever, even the presentations and everything, it is my postgraduates who help. And we keep on picking up new products and keep on trying it. And then based on that experience, we write down. This is my favorite song. And this is my fresh breath kit, which I give to all my patients. And you need to change. You have to be the change that you want to make. Okay. So this ends my topic for today. And if there are any queries or questions, I'm there for you to answer. Yes.
Thank you very much, Doctor. And it was very informative for the 2 days. We are very grateful to you on behalf of Iraqi Dental Association. And Doctor, now we just received a few questions. Okay.
Okay.
One question is from Dr. Nuran. She is asking, Doctor, can we use water and salt instead of the mouthwash?
Definitely you can. Definitely, you can use warm water with salt. Is an age-old remedy for halitosis. It's an age-old remedy. Okay, but again, see what happens now. Okay, the patients want something different. Okay, so and there are lovely mouthwashes with additional features also available. See, for example, the herbal mouthwashes have a lot of ingredients which will be more effective than your plain salt and water. So if you don't have anything, salt and water is can be definitely used. But when you have options, you can always recommend a good quality mouthwash.
Dr. Abir is asking, and I think it is a popular question: how can we choose the best toothpaste? What is
I
the
didn't get the
criteria?
question. I didn't get the
The
question.
criteria, the
Huh.
criteria of choosing the best toothpaste, the toothpaste.
See, now, for example, now for kids, we have to use a fluoride containing toothpaste. Okay, that is known to us. But when we are talking about halitosis, okay, for sensitive teeth, we are using sensitive care. But for halitosis, you have to use a toothpaste which doesn't contain alcohol, which doesn't contain sodium lauryl sulfate, because these two agents cause dryness of mouth. Okay, so anything that causes dryness of mouth will lead to halitosis. So you have to pick up a toothpaste which doesn't contain sodium lauryl sulfate and it doesn't contain alcohol. That is best suited for your bad breath patient because he can brush 2-3 times with that. There will be never dryness of mouth. See, because if you experiment yourself, I told you all last time also that you brush your teeth, and after brushing your teeth, we all feel like having a little bit of water. The reason is that our mouth turns dry after brushing teeth.
Doctor, there's a message from Dr. Nasreen. She is sending, thank you for your lecture, sir. It was awesome.
Oh, thank you so much. Thank you so much.
Dr. Nael is asking a question. Thank you for the
Yes.
presentation, doctor. It was awesome. As I see, you encouraged us to use pan to freshen the breath, which is widely used in India. The
Yes.
pan is the main cause of oral submucous fibrosis, which is a precancerous condition. What do you think about this?
Yes, sir. Now, see, the pan, if you understand, two components are very much added in India. One is the areca nut and one is the slaked lime, that is chuna. Slaked lime, that is calcium hydroxide, a form of calcium hydroxide. So these two things are carcinogenic. But the betel leaf by itself and the basic ingredients like fennel seeds, clove, coconut powder, and the rose petals do not cause cancer. The addition of areca nut paste and slaked lime, that is called as chuna, is carcinogenic, definitely.
Another message from Dr. Muhammad. He is thanking you, Dr. Iqbal. Thank you, doctor, for the excellent presentation. There's a question from Dr. Hadir. Dr. Hadir
Yes.
is asking, why mouthwash companies put alcohol in mouthwash?
I didn't understand. What did you say?
Dr. Hadir is asking, why the mouthwash companies put alcohol in the mouthwash?
See,
Why they do
alcohol,
this?
I think the alcohol is basically a preservative. So if you put alcohol, the shelf life tends to increase also. So
Okay.
if the alcohol, yeah, that can be one of the reasons. That can be one of the reasons. So that's why if you have an alcohol-free mouthwash, what happens is that the shelf life reduces, so the sales might be affected definitely. I mean, if you have an expiry date of 3 years, so your stock can remain in the market for 3 years. But if you have it, just 6 months or 1 year, then it becomes very difficult for them to sell. So it is
Okay,
a preservative. Yes.
Yeah, no, go on, doctor, go on. Okay.
Yeah, that is one of the reasons. And see, we know that alcohol is a known drying agent. See, people who drink definite alcohol, like we're talking about whiskey, beer, and all that, they always have dryness of mouth. Okay, so we should avoid alcohol. There are various reasons for that, but as far as from medical point of view, if you have to ask me, dryness of the mouth is the major cause. For bad breath, I will not use alcohol containing mouth.
Okay, doctor, another question from Dr. Sarah. She is asking, doctor, how many times we should use mouthwash and for how long?
See, mouthwash is generally supposed to be used twice and generally after meals. Because after meals, sometimes, and towards in the night also, before sleeping. Before sleeping, you should definitely use a mouthwash. because that's where the maximum activity takes place. See, that's why, and you try it tonight. You brush your teeth tonight. You use a mouthwash and you clean your tongue. In the morning, the mouth will not stink. And more important than the mouthwash, if you ask me which are the two most important things, I feel tongue cleaning and toothpaste can definitely help. Mouthwash is just to help further. Mouthwash is not, and that's why it's supposed. If you understood, I told only two things you have to fix in the menu. One is the toothpaste and the tongue cleaner. The mouthwash, the mints, you have to taper it. They are not so essential.
Okay, doctor, for how long each time?
See, mouthwash, when the patient comes to you initially, for him to get used to cleaning his tongue properly, changing the tusi, because what happens, tongue cleaning takes time for you to develop the expertise to clean the tongue. So you have to give them 15-20 days. So effective tongue cleaning will begin after a lot of practice. So 15-20 days, he will master tongue cleaning, and then his tongue cleaning becomes really good. So I always tell at least for 1 month they are supposed to use mouthwash, so that it helps. It helps further.
Doctor, there's another question from Dr. Iqbal. The question is betel nut and pan with katha and tuna. Is it advisable?
No, not at all. Betel nut, areca nut. See, betel nut is katha. It is not recommended. See, these are the carcinogenic agents. Chuna, pan, katha, or chuna, katha. These are the things which have carcinogenic potential. Otherwise, coconut powder, no problem. Rose petal, no problem. Fennel seeds, no problem. Clove, no problem. But they keep on adding these ingredients. And tobacco. In India, tobacco is added. Tobacco, once added, it is done and gone. I mean, it will definitely not, it is definitely carcinogenic. And we have toothpaste which contain tobacco. In India, we have something called as a mishri. Mishri is burnt tobacco. People use it for brushing their teeth. I mean, they apply that burnt tobacco to brush their teeth, because when they apply this agent, they get that kick. I mean, when you smoke, what do you get? A kick. They get the same kick because smoked tobacco is different and this is powdered and burnt. So they use that also. So pan, as I recommended, is good. But if you add those ingredients, your chances of inviting carcinogenic things is there. Plus, like adding sugar. Like, for example, they have chocolate pan, they have ice cream pan, then they have pan which is dipped in rose syrup. All that is not beneficial. See, we have a habit of spoiling a healthy thing. Now, for example, tea. Black tea, very good. But we add milk, we add sugar, and we spoil it. Yeah.
Okay, doctor. So I think now we are done with the questions. So before we, sorry, there's another question coming. Dates and chocolate. Okay, dates and chocolates, both are sticky. How to get away with this?
I didn't get you. The question, your voice is breaking, Dr. Abdullah.
Sorry, doctor, the question is dates and chocolates, both are sticky. How to get away with this?
See, dates again, I think there are a lot of variety of dates which are available. So if they are sticky, the benefit of date is definitely there. Okay. So after that, you need to rinse and clean yourself. There is no other alternative. Okay. I mean, who can challenge the use of dates? I mean, dates have got lot of benefits. Date syrups are also available. So date, you can't stop date. So if you feel it is sticky, then you rinse after that. See, for example, I told you honey. Honey is very good. So it is better that it is having in a more, dissolved in water, so that it doesn't stay back here and there. That.
Okay, doctor. So I think now we are done with all the questions. So on behalf of Iraqi Dental Association, we are very thankful to you, our dear professor, for the nice 2 days that you spent with us. And we are very thankful to our participants from Iraq and many other countries. So doctor, before we end our amazing 2 days with you, do you need to have a final word for the participants? Anything you like before we end?
all I could say is, see, dentistry is one of the most amazing professions, and there is so much scope. I mean, so I always tell people, don't focus only on maybe implants and endodontics and gum surgeries and all that. Focus on things which are there, like this. For example, a bad breath clinic. I mean, how difficult it is to set it up, how expensive it is to set it up. It is just, and believe me, it really helps. And I have seen that I get invitations to speak on bad breath. I mean, say, suppose I'll give you an example. That suppose you have to speak in some company. If you tell them I'm a dentist and I'm going to talk about dental health, they may not be interested. But if you tell them, okay, I'm a fresh breath specialist and I'm going to talk about bad breath and I'm going to check everybody's breath, what is the possibility of you getting an invitation? You will definitely get invited more. Fresh breath is the in thing, and we should take, like really get into it properly. I mean, it will really change your clientele will improve, your practice will improve, and you will be practicing dentistry only, but with a little bit of difference.
Okay, so dear doctor, thanks a lot, and thanks for our participant, and you all have a nice day. Thank you very much.
Thank you,
from
sir.
Iraqi
Thank
Dental
you.
Association Continuing Education Online Program. Goodbye all.
Yeah. Thank you. Good night. Good night. Have a nice day. Have a nice day. Yes. Take care.
Thank you.